Okay, so I'm with my good friend Anita, who I've actually served since 2007, so this is 12 years she's been under care. And we use different techniques with Anita. Some patients like aggressive techniques that are more forceful, and you might hear the popping or clicking. With Anita, she works really well with lower force techniques, so not every technique has to have a high force to it. So I'm going to demonstrate with you and adjust Anita and work on her lower back and the rest of her spine as well. All right, let me lower the table for you. Okay, go ahead and hold one down. Okay. So all I'm going to do, Anita, is just talk through what we're going to do, okay, what we normally do with you.
Yeah.
Okay, so with Anita, we use a technique called Sacro-Occipital Technique, which uses blocks. So these blocks allow us to put Anita in a really good position, takes pressure off of her lower back and her pelvis. So this de-stresses the body. So when someone has a lot of back stress here or complicated disc issues, this relieves that pressure to allow everything to open up and just very gently work through her body. So then we also do a lot of breathing and stretching at the beginning. So just take a breath in and out. So we're just doing some gentle cross stretching here. There was a little release there. So we got a cavitation or release just by stretching her. There was another one just by doing gentle work and rocking her body. So again, if somebody's a little bit more fearful of a high velocity adjustment or their spine just doesn't warrant it, we're able to use this type of a technique, which is very effective. And people say, well, what is, what's the difference between these techniques? They're all just techniques. They're techniques to take pressure off the spine. So I don't care if I take I-4, which is a highway here, or the 408, or colonial. I just care about getting to the solution, which is relieving pressure off the nerve system. And that's what's great about going to a chiropractor that is skilled in different techniques. This is called an Arthrostim. We're going to just work here nice and gentle. So low force in here allows me to work on the spine. I'm feeling her spine with my thumb, and I feel it release. In any area that's not moving well, I can work on that area just a little bit more and make sure that everything is moving very, very well. Good. Working the glutes. Good. Feel a little pressure here. Work on this, Anita. And then Anita has worked at a desk job. She's retired just recently, which is awesome for her. But a lot of desk work will affect the upper back and just leaning over and doing computer work. So we're able to work on this tissue as well. Plus, if you're a little vertically challenged, you'll notice the ergonomics in most office chairs aren't really good for someone who's a little shorter in stature. So that puts even more stress on the body over the course of years as well. So we've been working on those. This is an Activator, spring-loaded instrument as well, working along her traps, releasing pressure off of her neck. Good. So we just work through different areas, and wherever we feel that the body is not moving as well, or it's subluxated or misaligned, we can release that pressure. Okay, I'm going to come around. I'm going to take away the blocks. So we're going to come here and here. Okay, Anita, have a seat for me, please, love. Okay. Besides doing the care, the best part about patient care is actually the relationships you build up with patients. I've known Anita longer than I've known, I think, my wife. I've been married now 13 years yesterday or 2 days ago, and but I have known Anita for actually just around the same time, almost the same time. So I can do a twisting motion, the traditional motion where you might hear the popping or clicking in the neck. But again, this is just another technique that we can use, so it doesn't always have to be that way. So it's a really good demonstration if this is a good technique preference, so no one has to be scared about getting adjusted. You can see she's not screaming or anything, so I think we're in pretty good shape here. And she's been coming to see me for many, many years. Awesome. Good. All right. And that's it. All right, I'm going to lower you down. Thank you so much. Have a great day.
Thank you.
All right.